Bioretec released H1 report today, and we're glad to have the new CEO, Alan Donze, with us for an interview. Alan, great to have you and welcome.
Thank you, Antti. It's a pleasure to be here.
You recently started Bioretec, and most investors don't yet know you. So would you start a little bit about your background and what have you done so far?
Sure, I'll be happy to. Obviously, born and raised in the United States, I started out my career in the finance industry, working for various banks that had to do with investment lending, high leverage transactions back in the late 80s. And so I've got a financial background. I made a natural transition from a banker to a medical device sales rep in 1991 and started selling for Stryker Corporation and the endoscopy, sports medicine, orthopedics group. I sold for them for a few years and became a regional manager, eventually a director of marketing, then a vice president, general manager of two divisions of Stryker Corporation over a 14-year period. So spent quite a lot of time with Stryker Corporation. After that, I worked with a company called Asiat Orthobiologics, which was sold to Integra Orthopedics. But it was my first, entree into the orthobiologics world. So the biologics piece has been something that I've done for quite a while. I moved from there to Smith & Nephew and ran the biologics group at Smith & Nephew with a focus on spine and biologics, and did that for 7 years. Afterwards, I worked with Lima Corporate, based out of Italy, to commercialize the total joint space for shoulders, hips, knees in the United States, and also South America for Lima Corporate for about 3 or 4 years. And then I've had a couple of different consulting positions after that in selling sales companies in medical space as well as the digital health space over the last few years. So quite a long history in orthobiologics, quite a long history in orthopedics, and a really good fit for what we're trying to accomplish at Bioretec.
You've only been with the company for a few weeks, but what are your initial thoughts and observations on the company, and also your thoughts on how to develop Bioretec as an organization?
Yeah, I think, honestly, my initial thoughts have been that I've been so impressed with the quality of people. Everybody from Timo on down, just high character, great quality people who are very, very smart and understand exactly what they're doing to a great extent. I've been very impressed with the quality of people. I've been very impressed with the products, both the Activa line, which I was not quite as aware of, and of course Remios and where we're going with Remios. So I'm very encouraged by the quality of the product, by the quality of the people, but I'm most impressed with the opportunity that stands before us, because there is a large market that is clamoring for these products, and it's just a matter of how we get to creating the right products for them and the right kits and the right pieces and getting them approved through the different regulatory bodies and then getting them to the market as quickly and safely as we can.
So let's talk a little bit about the H1 report you released today. So starting from the top line, what were the main drivers or tail and headwinds for you for the top line?
Well, I think overall it was quite as expected, almost exactly on budget for us within internal budgets and things, and in line with expectations on the market. We continue to have a very good product line in the Activa that we are managing to sell quite effectively. And we had, of course, the controlled launch of the Remios product, which may not show yet the revenue, but shows very, very succinctly that the product works extremely well and as expected. So I think the top line for our revenue was that we were effective in all of our major markets in China and the US and Europe for Activa. And the Remios launch is going very, very well in getting our information from the surgeons and understanding you have to wait until the patient has had the implant 6, 12, 3 months, time frames to make sure that everything is going exactly to plan, and everything has done that. So we've been very encouraged with that and very satisfied with the top line.
One of the things you highlighted are pricing pressures in China based on this thing called volume-based procurement.
Yes.
So would you tell us a little bit about what the volume-based procurement is exactly? How did it affect you in H1? And what's the outlook going forward?
So the volume-based measures that the Chinese government is implementing goes across all medical markets, not just orthopedics, and certainly not just Bioretec. So it's something that I'm quite certain that the market can look at from every company and see these types of impacts. But it is one of curtailing and trying to squeeze each one of the manufacturers into fewer and fewer euros per sale. It is also, there are some corruption activities that they are mitigating with these volume-based things. So the overall impact is one of slowing down purchasing by the Chinese hospitals, Chinese government in general. So it's nothing more than an overall compression, if you will. Okay, so that affects all manufacturers, and we just call it out because it is something that everyone should know.
One of the kind of major events for you was the upscaling the production capacity during H1. So is that project finalized, or will it affect you going to H2?
No, we were down, and of course this was prior to me coming on board, but we were down in the first quarter with the production capabilities as we upgraded those machines and things like that. That has been completed. All the validations have been done, and we are now back to producing. As you can see from the second quarter, we rebounded quite heavily from the first quarter with production, deliveries, etc. So we feel like we are now well positioned for production in the second half.
You already talked a little bit about the controlled launch of the Remio screw. Would you say that the controlled launch period is finalized and you will start expanding the commercial operations, or how would you describe this kind of transition into a bigger commercial effort?
Yeah, unfortunately, it's not like you close one door and open a new door and you start a new phase. It's a transition. And there are, in the Remio's controlled launch, as I said, there are different time periods as an implant happens within a patient. Surgical patient comes in, they have the Remio's product implanted. At that date, they start their timelines of 3 months, 6 months follow-ups to verify that everything is going exactly to plan. So as those implants happen, then the follow-ups happen. So the transition, so the Remio's rollout is a staggered rollout, if you will, and we are very careful not to go to too many facilities because we want to be able to get all of the accurate information on each patient one by one and prove that everything is doing exactly as we say. Now, with that in mind, everything is going perfectly well, and we are excited about the results we'd have had from each one of the patients so far. We will now start in the second half of the year to transition into more of a direct commercial activity plan. I have hired a vice president of sales, Frank Sarcone, who started with us in late June, so just a few weeks ago. And he will be doing preliminary market work and preliminary logistics work to get us ready to do much more of a direct sales activity in the U.S. Currently, we have a single distributor and a single importer of product for the U.S. We plan to expand that over the next half of the year. So we will grow into more of a commercial phase over the second half of the year, but I don't want to set the wrong expectations. There's a lot of work that has to be done in each one of the states to create the right environment to sell and to have people in place that understand the product, that are educated properly, and all of the things that go with it. So we will transition from strictly a controlled launch into more of a commercial launch as we go through the second half of the year.
I know it may be very, very difficult for you to comment on this, but is there anything you can say about your sales expectations for H2?
No, other than I expect them to be higher than H1.
Good. Okay, so in Europe, you have applied for or achieving the CE labeling. Based on your wording on the report, it sounds like it may be coming quite soon. So can you talk a little bit about the European market once you get the CE marking? So you will, as I understand, the screw will be used for different indications, and that will benefit you in other markets. So can you talk a little bit more about this?
Well, I want to be very careful because you cannot predict regulatory bodies. You just can't. And so until we have a CE mark and an indication from those CE marks, I can't comment on what will happen with that. We are confident in our product and in developing the right information so that the CE mark, and obviously more than one CE mark over time will come, but I can't comment on how quickly that will come. At any rate, when we do have the ability to sell in Europe, we do have launch plans for the product throughout Europe. Some markets are more attractive than others based on pricing, and we will be evaluating exactly where to spend our time, resource, as we develop those markets. But we are excited about that. Remios is going to be a product once approval happens that I think will be very sought after, and we're excited about that.
Your next planned product is called drill pin, and you mentioned it's planned for the hammer toe indication. So is everything going according to plan? You've previously mentioned that the commercialization would be next year.
Well, in all of our hopes, we believe that we will get through the FDA's 510K processes with all of these products. But Remios is a de novo status, so it's a brand new material for the FDA, and there's a single predicate in the Remios screw. So just understanding, again, we can't predict regulatory bodies' decisions, and we can't comment on those. But we do have the products in line to go for FDA certification. And we're excited about the application of the drill pin and hammer toe, but also in many pediatric indications and things like this. There's a lot of opportunity where the Remios product line can be used, and it is a new and different material, one that will disappear over time and become bones. So we're excited about where it's going to go, but I don't want to predict how quickly everything happens with the FDA.
Okay, so for the final question, a little bit broader scope, what do you think are the main achievements you need to win in the short and mid-term with Bioretec going forward and succeeding?
Well, obviously, the most important things are the ability to sell the product. So regulatory certification, both in the US and Europe, are critical first steps, if you will, into launching a commercial product like Remios. I think that we need to continue to focus on the products that we have as well, because there's a great market for the Activa product throughout the global world, but especially in the United States, there's opportunities as well. So as we commercialize the Remios, I don't want to lose focus. We do also have a beautiful product line at Activa that is well received with a very long history, and there is great opportunity for those products as well. So we will spend a great deal of our time and resources as we bring on the Remios line through the certification. We will make sure that we also commercialize the Activa product line. So maintaining our goals of certification of products, doing the preliminary environmental work that has to happen to set the table for commercialization of both the Remios product line and a further expansion of the Activa line outside of our one distributor. Those are the areas that I'm focusing on, as well as gearing the company for scaling, because as we turn on these products into each market, we have to have the ability to scale our production quickly, safely, in a quality way. And so I'm focusing on the internal side of that and making sure that we are prepared to continue to scale. And I expect we will have to continue to look at our resources from a production standpoint and incrementally increase those over the years as well. Obviously, we're looking at growing, and so we look to make sure that our scaling is there for that as well. Those are my primary focuses.
Alan, thank you very much for the interview.
It has been my pleasure, Antti. Thank you very much.